Turner Publishing Company presents COVID, The Politics of Fear and the Power of Science by Marc Siegel, M.D. Read by Peter Van Norden. Preface. On the 27th of January, I warned my TV viewers about a virus that had originated in Wuhan and spread to several other countries, with 5 reported cases in the United States at the time. I've been studying contagions for a really long time, and I've never seen anything like this, I said. At the time, the Chinese government was reporting that at least 106 deaths had been attributed to the coronavirus, with more than 4,500 confirmed cases in the country. The State Department urged Americans to reconsider traveling to Wuhan and ordered all non-emergency U.S. personnel and their families to leave China immediately. I called China's delay in imposing quarantines and travel restrictions reckless and really scary, and indicated that I felt that the actual number of cases in China was far greater than was being reported. I also brought into question the role of the World Health Organization in obscuring the truth about the emerging pandemic and irresponsibly calling it a regional problem only. Unfortunately, the information coming out of China proved to be unreliable and in many cases inaccurate. Meanwhile, China restricted internal travel but continued to allow international travel, including to Europe, where the virus soon spread. Not only did we learn too late that you could easily acquire this virus from asymptomatic carriers and patients right before they developed symptoms, the rationale for increased mask use and enforced social distancing, but we also had to learn here in New York City on very ill patients that this was a multi-organ inflammatory disease that often caused blood clotting and vasculitis. It also became clear how important travel bans in advance of the virus taking root were, since once this transmissible virus was in your community, it would continue to spread despite lockdowns. New Zealand understood this better than perhaps any other country and instituted an almost total travel ban that has kept the case numbers close to 0 for months. Here in the U.S. and elsewhere, lockdown had a tremendous economic, physical, and emotional cost, as routine medical care was delayed, jobs lost, and depression and suicidal thoughts soaring, especially among our young, who were out of work or out of school, living in a state of relative isolation. Any attempt to...
Sample complete. Ready to continue?